Welcome to Biztech's Health and Wellness Show, presented by IJN, the National Heart Institute of Malaysia. In the Health and Wellness Show, we focus on equipping you with the knowledge on health and wellness to help you to ensure a more productive and healthy life for yourself, your families, and your employees. Now, I'm Brian Fernandez, and today the conversation is about how to monitor and manage diabetes. Now, to bring insights on this topic, we have Datuk Dr Zanariah Hussein, a consultant endocrinologist and physician. Dr. Zanariah, welcome to the show.
Hi, Brian. I'm glad to be with you.
Now, it's lovely to have a cheerful voice like yours, but could you start by giving us an overview of yourself, your training, and your specialty?
Okay. Well, I'm an endocrinologist. For us, we're usually internal medicine physicians first. Yeah, so I qualified as an internal medicine physician, and I've been doing endocrinology coming up to almost 20 years. Yeah, so we do endocrine training. Endocrinology is basically a specialty within internal medicine that deals with diseases of different glands in the body. And we've got a great many glands, Brian. We've got the pituitary gland, the thyroid, the parathyroid, the pancreas, the adrenals. I could go on. So the endocrinologist is who you would see if you have a problem with your gland, although generally the layperson would term it a hormonal problem. Yeah, but yeah, so that's what I do. Yeah.
Now, today we're going to zoom in on diabetes. Now, that's a significant public health concern in Malaysia. Now, according to the National Health and Morbidity Survey in 2019, 7 million Malaysian adults, and this is out of a population of about 32 million Malaysians, aged 18 and older, are estimated to develop diabetes by 2025. Now, what do you think contributes to these alarming numbers? You've been in this for a long time. Please tell us more.
Yeah, well, if you look at it, there's no way that we can escape this gradual increase in the rates of diabetes. I think it's seen in many countries, especially faster probably in Asian region. So as the population actually ages, you're going to get more diabetes because diabetes is an age-related disease. Yeah, diabetes results from the pancreas, which is a gland that is unable to produce insulin in the right amount and for the insulin to work appropriately. So there is some age-related incidence. So you can't escape that, increasing as our population is growing older, we will get more diabetes. Yeah.
Food related as well, Professor?
Of course, yeah. So yeah, it is very much food related. Diabetes is a lifestyle disease, a disease of a not so correct lifestyle, yeah, which is happening over years, yeah. So it needs a genetic predisposition. So often you would have a family member with diabetes, in somewhere in the generations, and then comes the sedentary lifestyle that as modernization happens, and then comes the overnutrition, or not necessarily overnutrition, but inappropriate nutrition with energy dense foods, that makes people overweight. And once you get overweight, somehow or rather, that hormone called insulin, such an important hormone, can't work efficiently. Yeah, okay. That's usually one of the reasons we get diabetes. But what we're very concerned about today is that what we saw diabetes happening for the first time when you're sort of maybe approaching 50 or even 60, we're seeing it happening in the 20s, in those in their 20s and in their 30s. Younger onset of diabetes is very apparent, especially in Asia.
Now, is that, and Malaysia apparently has according to my research, the most obese population in Southeast Asia. Now, is that and the ever younger patients that you're probably seeing due to the sedentary lifestyle, as well as just a rich person's diet? We're just eating more affluent related food, and that's the result.
I somehow agree with that, Brian. Yeah, definitely. younger people are also getting more overweight. I mean, the overweight obese problem is getting right across the ages. You know, it starts in early childhood now, and it goes on to later childhood, and you get adolescents with obesity, and then you result in adults with obesity. Yeah, so that is actually going to contribute to the large occurrence of not only diabetes, but weight related problems. So you get diabetes happening with high blood pressure, with high cholesterol, and then wham, you get cardiovascular disease, and then you get renal disease as well, and even chronic liver disease, or what you call fatty liver. So we're getting all that actually as a result of the sedentariness and the inappropriate nutrition that's happening.
Now, Datuk Zanariah, one of the things that's happened, of course, that's made all of this far worse is the COVID-19 pandemic. Now, that's brought to the surface the importance of really managing our glucose levels of people with diabetes. Could you tell us a little bit more on how this has impacted patients?
Yeah, so with the COVID-19 pandemic, I think we see globally there's been, of course, a definite change in impact on the lifestyle, where people can't really be very mobile, so they're stuck at home in isolation, and also therefore they are not eating accordingly as well. So it does run havoc to the control of diabetes. So we've seen that control of diabetes has been quite affected by COVID-19, and sometimes you can't go to your regular clinic or hospital appointments, and you may actually be coming later if you do have an acute problem related to your glucose or diabetes. You sort of delay it before you come to the hospital. So we're getting a bit more emergencies related to diabetes, like very high glucose coming into the emergency departments during the COVID time. So that's
okay. But then one of the things, Dr. Zanariah, is the fact that therefore it's very important for us, if we are diabetes patients, really to monitor our glucose levels consistently.
Yeah, definitely. I'll take you up on that. And also the fact that if you do have good diabetes control, even if you get COVID, then the chances of doing not so poorly with COVID is there, because what we notice is those that did really poorly with COVID, that means landing up in ICU and having very requirements for ventilation and even succumbing to the disease, were the diabetics with bad control. Yeah. So it's really important to keep your diabetes in check. Yeah. And diabetes usually means glucose, but it's not just glucose, to also keep your weight in check, your BP and your lipids and the overall thing that happens with diabetes in check. And to do that, you really need to monitor glucose, because diabetes is a disease of glucose, and it very often doesn't give you signals that are very definite when your glucose is high or low. So it matters to actually measure your glucose from time to time to ensure that you know where you are with the disease.
Okay, then how do we use continuous glucose monitoring? How does that help diabetes patients? And tell us what that's all about.
All right, so this continuous glucose monitoring, or we put it as CGM as short, is actually not something so new. It's been around for maybe a decade or two, but it's usually not used in such a big way in everyday setting, because of the technology behind it is difficult, and it also has some sort of high cost to it. But so the conventional way was to actually prick your finger to measure your glucose.
Okay.
And there are just so many times that one can prick our fingers in a day.
Exactly.
To measure glucose. So one of the most frequent complaint is, one is the pain you get when you need to prick your finger often to check your sugar, because glucose does change. It fluctuates within the day when you eat, when you exercise, so that's important. So with CGM, what you get is you need to wear a sensor that is nicely and easily placed on your own, and that can be on your abdominal skin or under your arm. And that sensor has a little filament that actually goes into your underlying fat tissue, and it measures your glucose in what we call interstitial fluid, and it measures it every maybe 4 to 5 minutes. and then it connects all the dots of those glucose, and that really represents what your blood glucose is in a way. So you're actually seeing real time. It's just like you're driving a car and you can actually see your speed change. So you're actually going through the day able to actually see your glucose fluctuate, and then you start to understand, what makes your glucose go up, which is food or stress, what makes your glucose go down, which is medications, exercise. Yeah, and then that really is a powerful tool to teach that individual with diabetes what to do, and what the right targets are. So then you can sort of modify your lifestyle, get better with your medicines, and you, after all, want to aim to keep your glucose in the best range possible.
Sorry, Doc, this is related to then what you're talking about is time in range, right?
Right. Okay.
Could you kind of explain that to our audience so that then they get that correlation as well?
All right. So yeah. What I'm explaining is exactly that you want to aim for your sugars to be in the best range that actually, avoid symptoms which are, not nice symptoms of either too low sugar or too high, and avoids the possibility of developing diabetes complications over time, because a lot is complications of eyes, kidneys, nerves, heart is related to having high glucose over a long time. So time in range is actually having your glucose in a range something like 4 to 10. You don't want your sugars going below 4 if you're not eating. You don't want your sugars to go above 10 after you eat. So 4 to 10 is a nice range. And so if you want to encourage people to have more glucose in time in range, and the best target is to have 70% of your overall glucose in time in range, and only a fraction, maybe less than 5% in the low range, and not more than 20%, for example, in above 10 range. So with this, it's a new concept, because before doctors would get patients to do a blood test every 3 months, and this is called HbA1c, or glycosylated hemoglobin. So you get a HbA1c, it gives you one figure, and it's supposed to tell you how good your glucose is. But you're not aware how the curves and fluctuations have been in the day and in the week, and you don't know exactly where you've gone wrong. You've just got a number, So it's
so
really...
this then really helps, in a nutshell, for a lay person like me. What this helps us then in terms of continuous glucose monitoring, and also then keeping in mind time in range, it really helps us to then manage the disease better.
Exactly. Yeah, it's the way that we can actually manage the disease better, avoid the highs and lows, and keep it in the best possible glucose in the best possible range. Yeah.
Okay, and then what, when with the ranges itself, will that then impact if we then keep it within the 4 to 10 range, largely, and you said 70% of the time? Will that then enable a reversal of diabetes, or will it just be a control of diabetes?
Well, it's totally a different story about reversal, but generally, if you keep your time in range in that category, you keep your glucose in the time in range or that category, you land up with what we call good control. And good control would mean that you really minimize your risk of complications. Diabetes reversal or remission is sort of a recent concept, because in the past we thought that diabetes is a permanent life sentence.
That's right. That's exactly right.
You get it, and it's gonna get worse, and you're gonna, you can just imagine. So now we know, and that's through a lot of research that has been invested, that if you have diabetes of a few years, not so long standing, maybe most of the studies were about 3 to 6 years and below of diabetes, and you were on tablets, maybe 1 tablet or 2 types of tablets. And if you do lose a large amount of weight, and often you are in the obese overweight range, and by the way, about 80% of diabetics in Malaysia are overweight obese range.
So
And
there's
if
a
you-
strong correlation between obesity and diabetes.
Yes. And if you lose weight, a substantial amount of weight, and this is about, more than 10 kilos, usually about 15 kilos, or they say about 10 to 15% of your baseline weight is
Okay.
lost. And often it's due to a definite caloric restriction. So it's a good diet and also supported by good exercise. Of course, this is sometimes a bit difficult because the calorie sort of amount is really reduced. Now, if you do this weight loss results in the diabetes getting better, so much so that you can actually stop your medicines, and you are then able to have glucose in the range of someone without diabetes. And if this persists for about 3 months and above, that means you have glucose in the non-diabetic range, you've stopped all your medicines, and it's still good after 3 to 6 months. You then now defined as, reversing your diabetes.
So that's interesting.
Possible.
That's something that most of us have no idea that can happen.
Yes. So, we really should be encouraging those with new onset, early diabetes, especially if they have weight excess, to have an option of, a lifestyle, intensive lifestyle program versus being on a medication straight away. This could be an option if that nicely structured intensive lifestyle program is there, which needs to be well supported and monitored by the healthcare provider and the patient, helping the patient to lose this large amount of weight, and then seeing how he could actually get off his medicines and go towards normal glucose. It's certainly possible, but it is not possible for everyone with diabetes. Yeah.
Okay.
But,
So then let's take a step back and what advice or key things that people can do and you could share with them so that they can reduce their risk of getting diabetes in the first place.
Right. I like that, because prevention is always the best thing. Yeah. And I think if we just look at the typical Malaysian adult profile, we already have a risk of developing diabetes.
Because of our food.
Yes. So actually keeping a check on your weight and hoping that your BMI falls in the optimal category BMI. And that, unfortunately, as an Asian, is not similar to a Caucasian. So our optimal BMI is anything between 18 to 23. Yeah. Okay. Whereas the Caucasian is 20 to 25. So keeping a good BMI and also then leading an active lifestyle. This is very general advice. And keeping in check about, how about your food, your diet, and the kind of carbs you eat, the amount, the type. So it might be too lengthy if I give you all the great detail, but so especially so if you have a family member that has diabetes already, you are at great risk to get it. So what we can do is, even if we can't, prevent it completely, what we can do is we can delay the onset of diabetes. It might not be too early, it might be later, because we're actually doing all this healthy lifestyle bit. And also if you have diabetes, can we have just a milder diabetes that is easier to manage with lesser medication, because we're putting in the effort with everything else, because sometimes diabetes is not just about lowering the glucose with medicines. It's lowering the glucose with the help of weight management, lifestyle, So that is really important. I think a lot of people are missing that bit. So the medication list gets really long, and no one wants to take too many medications for any disease, especially.
So we really need to look at it, Dr. Zanariah, from a holistic perspective. It is not just family history, it is lifestyle, it's your diet, to manage the disease itself. If you understand that you've got it, you've got to manage it. Of course, you start with trying to avoid taking any sort of pharmaceuticals first, and then after use the monitoring tools, try to get your levels down, as you pointed out earlier in this session. And then after that, if all else fails, then we go on to the medication portion.
Yes, yes. In a way, that's completely right. Yeah. And just to mention that doing the CGM, you know, we used to think that we'd do it later on in diabetes, you know, but there is some evidence that doing it early will help people, you know, adhere better to their lifestyle. So CGM has made people, you know, help them lose weight, help them get their sugars in check, and certainly their diabetes better.
Dr. Zanariah, this has been a very educational conversation with you, and I really enjoyed it. But before you leave us, are there any final thoughts you would like to leave us with before we end the conversation?
Well, you know, what I think is with regards to diabetes, I think you've got to understand it, you've got to prevent it, and you've got to control it. Yeah. And you need to really live well, generally, whether you have diabetes or not, you've got to have a good quality of life. And so that's my general sort of last message to everybody, and healthy quality of life.
Healthy quality of life. We'll leave that. With that, thank you very much for taking the time to be on the show, Dr. Zanariah.
Thank you. All the best.
Now, I'm Brian Fernandez, and we've been speaking to Datuk Dr Zanariah Hussein, a consultant endocrinologist and physician, on Biztech's Health and Wellness Show, brought to you by IJM, the National Heart Institute of Malaysia. This video and podcast will be on Biztech's social media platforms, as well as our website, www.biztech.asia. Please subscribe or like our various platforms. Thank you very much for tuning in.